donor dominance and recipient site influence, impact on hair transplant outcomes. Dr. Lam is from Dallas in USA, where he runs a hair transplant center. He is a facial plastic surgeon and a fellow of ISHRS. He is the president-elect of the American Board of Hair Restoration Surgeons and has written a very nice textbook on hair transplantation. He also runs a very successful conference on hair transplantation at his place. Dr. Samuel Lam.
धन्यवाद। नमस्ते, मुझे यहाँ आमंत्रित करने के लिए धन्यवाद। We all know about donor dominance, courtesy of Norman Orangereich, so I'm not going to go into details about that. So we want to talk about this into what do we mean by recipient influences. So clearly we all think that if we transplant hairs into the eyebrow, it could grow more slowly. Could the beard be different after transplantation? How about if we take scalp hair and put it in the beard? What if, into the beard, or the beard into the scalp, or the scalp into the chest? So we have to figure this out, and I may raise more questions and give you answers during this. So I took a survey of some of the people that I know, my friends who do a lot of eyebrow transplants, and is there a change to the eyebrows after a year of transplantation? Do they grow more slowly? Are they finer? I'm not convinced of it, and a lot of my colleagues are uncertain or they don't believe so. There was a study in leprosy cases that showed that there was actually a slowdown of the grafts growing in the eyebrow. They became less gray and changed. So maybe there is a role. I don't think there's a consensus on this. I asked my colleague, Tommy Wong, who did a study in 2005 taking chest hair and moving it to the scalp, and he put it into just one area. The rest was done with scalp hair, and he found that after about a year of the procedure, he looked at what happened, and he found that the chest hairs grew as long as the scalp hairs. And if you guys do those kind of transplants, you'll probably see that. And then I asked my colleague and friend Bob True, and he said, yeah, he actually has noticed the same thing, and he found that the hairs over time become actually straighter. So that's something to think about. Are there recipient influences that are present? On the flip side, are there donor influences? So I asked my colleague, Paco Jimenez, who's the current president of the ISHRS, as you know, about this study where he looked at ulcers. So what he did in the study was he took half a wound with the punch grafts from the abdominal area, just skin only, and then he took some that had hair-bearing tissue into a split wound. And as you look at this progression and you go all the way to 18 months, you can clearly see the inferior aspect of this wound with the transplanted hair grafts showed two things. One, they actually healed so much better in these diabetic ulcers. And the second thing you see is the hair grafts didn't survive. So, people always worry about putting hair grafts into areas of, where there shouldn't be hair. You may consider doing it based on some of his studies. I think it's very interesting. So the hair grafts don't survive for the most part, but the wound heals itself. So some of those thought processes out there, for example, you may have noticed in your work, if you put hair grafts into scars, that the scars soften and they may take up better grafts on a second session. So these are all controversies. There's no clear, large-scale, multi-center study that can be cited. So in my own cases, I was asked to do this talk, so I started to think back in a lot of this retrospectively. So I haven't analyzed in detail these patients, but I just sort of think in retrospect. So here's a gentleman that presented to me in 2005 or 6, class 5-6 balding, clearly pretty extensive in nature, but pretty miniaturized throughout. Did a transplant on him, started on medical therapy. This is probably about 9 months out. I did not transplant his crown. He's just, some of that is regrown through medical therapy and also through the way he combs his hair. And then he came back to me in 2014, about 6 years later or so, after the initial treatment, roughly, and all of a sudden he's lost all this hair. And he still has some of the transplanted hairs there, but I was devastated and wondered what happened. And this rarely occurs, but I see it. So then you start thinking, well, is it donor dominance in terms of the fact that there's just miniaturization in the donor area that I didn't diagnose, or that progressed in nature so that over time you actually had a DUPA? Or was it the fact that there was recipient influences causing those grafts to lose? I'm sure all of you who are experienced hair surgeons have a minority of patients like this. So I looked into his donor area, and there was some miniaturization, but he underwent another linear strip procedure and was started on medical therapy. And the question then is, look at his crown. I didn't transplant his crown, but his crown regrew. So clearly there were some influences of the miniaturization reversing even those that are completely bald. As you know, that a completely bald scalp still has hairs underneath the skin. So they're there. So could it be a combination? Maybe that some of his donor hairs that miniaturized over time regrew, or was it the fact that he just regrew a lot through medical therapy? So the take-home lesson is we always see these cases and we shy away from them, and rightly so, these DUPA cases that are quite obvious from a distance. You can see this from a mile away, but then sometimes I've been shocked. I do a surgical case and I go and I start looking at it even more carefully, and there's a higher level of miniaturization than I even thought or saw dermoscopically initially. There was just things that I may have missed, and then there can be problems by missing this. And this is a gentleman that presented to me that had multiple linear strips done elsewhere, followed by an FUE over harvesting. And then he has extensive miniaturization and he refuses medical therapy. Sort of your perfect candidate for a good transplant result. No, I'm just joking. But this is clearly a disaster. So, the first option is just to say, I'm sorry, sir, if you don't take medical therapy, if you don't want to be part of this, send him on his way. And that's clearly a reasonable option if the patient is not going to be compliant. But the question is, what is going on? Clearly the number one problem is bad judgment and poor technique. But also it's prediction. If you look at how extensively miniaturized he is, what would you do in this case? Would you just send him packing? So I did a limited procedure of FUE into the scar as well as SMP into the scar. He refused medical therapy. I documented everything. And this is not a great result, but at least maybe buys him some years. But what is going to happen in 10 years? I did a very conservative SMP, because what if that hair grays? What if he loses more hair? There's so many issues here for someone that is not fully compliant. This is another gentleman that I did a linear strip procedure on, and I made some judgment issues here that I think are wrong. He had a pretty dark hair in the central area, and after transplantation, you can see that it doesn't look right. There's just too much dark in the front. I presented this, actually my assistant presented this in the assistant section of St. Louis, and someone said, no, it's actually, he has seen a recipient site change where actually the hairs turn darker. We often think it turns lighter when we place in the temple, but he said, no, I've seen it where it turns darker. So maybe this is a combination of both. Is it which one? I don't know. I mean, this is all very, when I was asked to do this talk, I had to think back in my cases, what examples? There's a gentleman who progressed to a Norwood 6-7 with thinning all throughout, and he has bad hair grafts on the left. So this is several sessions of 100% beard transplant, and this is done over time. Now the question is, do his hairs look better now because of recipient influences where the beard grafts became finer, or did because his beard grayed out that it became grayer, so then it looks more natural? Or was it the fact that he has so much more density from multiple rounds of beard transplant that now you don't see his previous grafting? I don't know. I mean, I wish I could sit up here and give you a consensus and just give you a simple answer, but I don't know, and I think that what's challenged me doing this talk is going back and looking at these cases more in depth. So here's his crown. This is after about 3 rounds of beard transplantation and also some medical therapy, and this is over several years. So if you look up close, are his grafts finer? Are they better? Or is it the graying? Or is it the multiple transplant? Or is it the fact that his medical therapy has given him some fine hairs to blend in with his other hairs? I don't know. I wish I could just tell you it's one of, and maybe it's all. As you heard from Dr. Satura, there's multiple factors. And I agree with male hair loss, there's so many factors. It's nutritional, it's epigenetic, it's genetic. There's so many factors. So here's another view, and what's going on? Is it close-up range? I think it's all of them. To be honest with you, I think it's some recipient influence, I think it is some medical therapy, and I think it's some graying of his hair. But the other take-home lesson from this is look at the judgment issues, multiple strips done elsewhere, all over the place with advanced baldness caused a lot of issues for this gentleman. This is a gentleman here who came to me with a linear strip procedure done elsewhere with a lot of his grafts miniaturized, and so almost looks as if it's just male pattern baldness with some retained frontal hair. But those are actually transplanted hairs that have been miniaturized. So I just put him on medical therapy, well, you saw that. And the backside, look at how much growth there is in there. And look at his donor hair. That's really Dupa. You know, this is he has got miniaturization throughout. So clearly, either the grafts got better because they were reversed, because look at what happened to his donor hair. His donor hair, where the strip was taken, reversed as well. And the scar that was bothering him also got covered for now. So the consensus is, in my opinion, there is not an easy consensus on this, but I think the consensus, if we have one, is the fact that it's multifactorial. I don't think it's so easy to say just because I can show you one case where there's recipient influence that's the dominant issue, or oh my God, if there's donor influence, that's got to be the case in every situation, because it's so variable, absolutely variable. But it's challenging me as a surgeon to look prospectively at my cases more attentively. Whereas in this exercise, I was talking about retrospective cases, which I wish I could go back and look at those cases more in detail, microscopically. So Dupa is a spectrum. Keep in mind, look carefully dermoscopically, look at it surgically, look at those cases where there is cases where, we define Dupa as over 25%. What if there's 12%? What if there's 20%, 23% miniaturized hairs? Does that count? And just don't count on recipient influence. Don't say, well, there's going to be recipient influence. We don't know. And always look at the fact that you've got so many tools in your belt. And this is why I encourage you to be diligent about medical therapy. Think about scalp micropigmentation. If you don't have an artist to do good work, have someone work with you on SMP. Be able to be diligent in doing both FUE and linear strip if possible. And also the best option sometimes is don't do anything at all. And I'm on the scientific committee for Panama, and I'll be running the advanced board review, so I encourage all of you to come. As you know, I'm the vice president and the incoming president for the ABHRS. I encourage you can ask me questions about that, the exam. I'll be running that exam in Panama. And I don't make any money on any of these courses I run, but I encourage you to come in July of this year to St. Louis. It is really for beginners. I mean, if you're advanced, you may get something out of it, but it really is for beginners to intermediate. And what I always tell people out there is that it's not just about what you listen to me lecture, or you watch me talk, or you watch me operate. When I watch you do the work, I know within a minute how to correct some issues. Literally, I mean, I can see, I go, okay, your major problem, your recipient sites are too close, they're too far apart, they're not consistent, your hairline is asymmetric, it's down tilting. And then I come back with a small group environment, and within minutes, I see the corrections. And I use a Socratic method of education where we talk to each other, and I say, okay, you tell me what's wrong with this hairline design that this gentleman did. So very passionate about that. Again, I have no financial disclosures on any books or anything. All my money goes to charity. It actually, as you know, a huge problem in India and across the world is human trafficking. The money that from my books goes to stop human trafficking. Okay, thank you very much.